Contact.
Dr. Blake Staker with Westside-Medical. Today we're going to cover the Revers Hyper here. We're going to go over patient placement as well as the patient progress using the machine. So the first step is we want to show the patient how to properly get up on the Revers Hyper here. The way I do it is I have them place one foot here, another foot here, and get comfortable with their balance. They're gonna hinge at the hips, right over the table, and they can take one of two hand grips here, whichever is more comfortable with them. And once they do that, you'll notice most of the time the patients will have their hips all the way hanging off the table here. And that's an okay position if your back doesn't have an injury where you're more advanced with this machine. But from an initial standpoint, have the patient put their hips all the way up on the table like this. This is really effective for patients that have a pain level where they can't do any other exercises. So from here, we'll let them drop their hips about 30 degrees and make sure it's pain-free. And so they're getting a mild traction. We'll have them start off with a set of 5, just raising the hips just like this. And if they can do 5, we'll bump it up to 10. And the purpose of the movement is that small motion there promotes inflammation clearance in the low back through the compression of tissues. So when they bring the hips up, that compresses the low back muscles, and then when they relax, it tracks out the tissues. The importance of clearing out the inflammation is inflammation, it's not a bad thing. You have to have inflammation for healing, but you need to manage the inflammation. And so when they go through this range of motion, it's clearing out all the waste as well as the oxygenated fluid, and it's making room for the new fluid to pump in that carries the healing factors. It also carries growth factors and stuff like that. So once the patient is able to do that motion, let's say on the second visit, we'll have them hop up here again. So both feet on here, going to hinge at the hips, and we're going to have their hips a little bit more off this pad so they have a greater range of motion. So right about here, and so the range of motion is about 60 degrees. We'll have them go through the range of motion. Once again, tractioning the back and pumping the tissues to work out that inflammation. We want to make sure, once again, that it's pain-free. We'll probably shoot for around 3 sets of 10. And as they progress, eventually we'll get to the starting point that I like, is where the pivot point for the femur head is right here on the table. And the leg's going to hang down, and you'll start off with full body weight reverse hypers, like this. Making sure the lats are tight and your abdominal brace. And once they're able to do those, we start off with just the strap and the resistance. Once again, go through the range of motion here. We want to work up to 3 sets of 10. And from there, we progress to adding plates as well as volume, maybe 4, 5 sets of 10. Any more questions? Visit westside-medical.com.